pandemic has illuminated the challenges we face in meeting the behavioral health needs in our communities. Three experts weigh in on what it takes to build a network that supports an effective behavioral health strategy.
There are many challenges, but the first that I'd tee up is stigma. It has existed for decades. Just recently, I think we are beginning to see the tipping point of individuals beginning to realize that psychiatric and substance use disorders are physical health disorders. So we are beginning to see the change, but the stigma that has existed for years has influenced the other challenges in terms of their magnitude. Second, I would add the inadequate payment and coverage of psychiatric and substance use disorder treatment. The coverage, even when it does exist, often individuals with mental illness are twice as likely to be denied access to treatment because they say it's not medically necessary. On payment, just one statistic, behavioral health workers are paid on average 20% less than primary care physicians. So coverage and payment, improving those is key.
I think first and foremost, it's exacerbated what already was a very challenging situation. Mental, behavioral, psychological, substance abuse issues exist within our communities, and they're only growing.
The rates of depression are up threefold, and we've seen overdoses increase in over 40 states. Thankfully, it's also increased the use of technology and digital platforms. Telebehavioral health has allowed our hospitals and health systems and others to improve access to care, turn around on a dime to provide those needed services throughout their communities. And then finally, it's increased awareness, which hopefully is reducing stigma.
Well, the first thing I think that health systems need to realize is that it's a team sport. We can only make so much impact in our organizations, and there needs to be a greater community effort for this population because they're exceptionally complex and in need of many different types of services that hospitals and health systems in most cases don't provide. So the first step really is to recognize that a good solution and a population health type solution has got to involve a lot of other organizations.
WakeMed really reached out to do an inventory and to act as a facilitator to bring the significant number of community-based, faith-based, not-for-profit, and governmental organizations together to assess just how much resource and how the processes work within our community. And once we were able to do that, we developed really a lot of coordination around what each organization needed, how we could streamline the process through which referrals happen, and how they could better match what resources they have with what the patients and their families need.
One of our key statistics is tracking what I call days in waiting. So patients are medically cleared, they just need to be connected to behavioral health care. And we've been able to decrease those days 64% because of what we've put together from a network perspective.
So the first thing that is very important is CEO buy-in. That's key. It's also helpful to have a behavioral health service line leader who can really champion the day-to-day work. But if you're going to do a community partnership, it is critical that you have a broad group in agreement who view themselves as owners in this journey. And then don't let the return on investment or the financing of a community partnership and network be the barrier that keeps you from going down this path. Studies have shown that improving access to behavioral health care can improve outcomes and bend the cost curve, so the returns will come.
What really helps is an openness and willingness to listen and engage the community and community providers. When you really start to include folks in that, you get a chance to see just how many resources they are. Don't underestimate the influence. We're one of the largest referrer to these organizations, and also don't underestimate the thirst that they have to try to be a part of a better system through which our patients and community gets care.
But what we did was we brought a lot more resources to the front door to be able to sort out these complex patients in a new and different way. So we literally have our behavioral health team at the front door working with our emergency department team. So we have emergency room physicians, nurses, and staff on the emergency room side, as well, and paired that with our behavioral health team, which includes behavioral health social workers and behavioral health psychologists. So we put the patients through a really extensive evaluation process. And because of the complexities associated with these people, one of the hardest things to understand is what are their true needs, and then how can you match those true needs to that individual patient to create the impact in their life that you want to.
I think the key is to educate and integrate. We need to educate our community partners that through collaborative networks, we can improve access to care. We need to educate them that we can pool our resources and thereby release the pressure that all of the organizations are feeling right now. And we need to integrate so that we can eliminate the duplicative services. All of this combined will improve access to care, improve outcomes, and reduce the total cost of care.
First and foremost is recognizing how much you are currently investing in both housing and delivering care to unmet needs in the community. And I encourage you to look at, it really doesn't take a tremendous amount of investment to bring a bunch of community-based organizations together and work through the inherent ability that most health systems have to improve processes, streamline access points, and really create an environment through which those kind of discussions and collaborations can take place.
Our community looks to us for answers for health-related issues. It's our duty to serve our communities in that way. And so what we did, and what you all can do, is just be that convener and that collaborator in your community. Yes, you need some assistance from the standpoint of standing these things up, but the costs involved really aren't that large comparatively to a lot of other things that we do in health systems.
So the way I usually answer that question is that 1 out of every 4 to 1 out of every 5 patients that are admitted to a hospital have a behavioral health disorder. It's secondary, but it's there. So you're already treating these patients. So what's next? Are you going to develop your own internal behavioral health program so that you can hopefully reduce the length of stay and improve outcomes? Or are you going to contract out for it? Maybe partner with your community mental health center. There are ways to do this.
It's fulfilling our commitment to reduce suffering. And I can tell you that patients and families are really suffering now. Yes, with the COVID, but from a mental, behavioral, and substance abuse standpoint, they are truly suffering. And so we, as the health community, have a responsibility to leverage our talents, leverage our strengths, leverage our resources, but more important, stay true to why we're here, to work together to make a real difference for those that trust us.
So my call to action is for all my colleagues out there to take on this challenge, run towards it instead of away from it. Because if not us, then who?